Hello, Slidell. Today is Monday, July the 20th. I'm here with Dr. Chuck Preston, our coroner. We want to talk to you a little bit about COVID, what's going on in the community, and I want to emphasize the importance of supporting local businesses. I've been down in the Old Town area and around town a little bit, talking to some local business owners, and you know, they need our help, folks. If you have the option to purchase something at home in a local store or purchase it online, please purchase it at home. Use these local mom and pop stores, these folks that have supported our community for many, many years and have been here for many, many years. Some are new businesses that haven't been here many years but are going to be the fabric of our community. What makes us unique, all of our moms and pops and the stores and businesses that support our community in philanthropic ways, in providing services to our community, and just being there when we need them as a friend. So with that in mind, if you have an option to shop a local store, do so. You know, shop the mom and pops, shop the local businesses, shop with the people that you know, the owners you know, the people that you see. You go in a store, you go in a restaurant, and the restaurant owner or the owner of the store may be the one that actually helps you find something on a shelf, or the restaurant owner may be the one that takes your order in these days. If not, he's going to come by and tell you hello. But it's that personal touch that makes us unique and keeps these businesses alive. So please, by all means, at any opportunity you have to shop local, take advantage of it. I want to talk to you a bit about that, but I also want to talk to you a bit about COVID. The trends, the numbers seem to be going up in our area, in our region. If you look at the numbers for the state, put out by the federal government, the CDC, we're back in the mix with a lot of cases coming back around. In St. Tammany Parish, we've seen an uptick, a rise in our curve is starting to go up rather than be flat, which is not where we want it to be. We want to have a flat curve. That way we don't put any more pressure on the healthcare institutions, the healthcare providers, healthcare delivery system for our community than is already there. So we want to make sure that we get that curve flattened back out. There's a number of ways that you can do that, as Dr. Preston will really emphasize in a moment, with masking, social distancing, avoiding crowds if possible, coughing into your elbow, taking all the precautions to protect those around you as much as you do take precautions to protect yourself. Sanitizing your hands, keep a little hand sanitizer in your pocket as you move around, go from place to place, pick up things, touch things, sign a credit card statement, touch a keypad on a credit card machine, all of those things. Have a hand sanitizer with you, just touch up your cleanliness whenever you walk away from that. So, with that, I'm going to give Dr. Preston an opportunity to make a few opening comments, and then we've got some questions here that folks have submitted in the past week, and we'll address those questions at that point. So Dr. Preston, if you would, give us some words of wisdom.
So thank you, Mr. Mayor. I really appreciate this opportunity to share information, and I want to echo that the physical health of the parish is also reflected in the economic health of the parish. And I think that my advice to Parish President Mike Cooper to institute masking early on before we reach critical mass in the healthcare industry also was an attempt to try and keep the economy alive. Nobody wants to go backwards. But if the cases spike and the death rate spikes, then we're going to be forced to move backwards in economic development. We want to continue to move forward. And just like the mayor said, it's really very simple, just like it was in March. Wash your hands, cover your cough, social distancing, and wear masks. And I think the object lesson of not following those guidelines is in our neighbor in the state of Florida. And we certainly don't want to be in the same situation as the state of Florida. So now, while we're in a good position, this is the time to act. If we wait until the hospitals are saturated, it is going to be too late.
Okay. Chuck, thank you for kicking us off there. Let's take some questions. We publicized that we'd be doing this video last week on our webpage on Facebook, and we had 15 or 20 questions that were received, and we kind of condensed them all down into about 7 questions here. So I'm going to offer the first one up to you, Dr. Preston. Medical experts seem to be in disagreement about wearing masks. At first, the CDC said that masks weren't effective. Then they changed course and said everyone should wear a mask. Now the WHO is telling people that masks don't work. Why is there so much confusion, even among the experts, about wearing masks? Will masks protect me? Will they protect the others around us?
And I think that's a very good question. I have to go back to my friend Bill Borshett when I was first running for office, who said, you know, you make a decision based on the best information at the time you get it. And one thing we've learned as we go through the pandemic is we're learning new things every single day. I think early on there was a caution about people buying masks because we wanted to make sure that the healthcare providers and the first responders had adequate numbers of masks, and there was a fear that the supply chain would be interfered with and those healthcare workers would not have adequate protection. Now we've had some time to build up our supplies. Some studies have been published about respiratory droplets and how far they expel out of your mouth with normal talking, singing, coughing, etc. And there's no doubt that masks will help to slow the spread of the droplets. I recently heard somebody quote it wasn't really a WHO study, the World Health Organization, a representative during a press conference said, we're not so sure they work, and the very next day there was a retraction, and we are sure that they do work. And so the best advice based on the data available today is to observe those 4 simple steps. Wash your hand, cover your cough, social distancing, and absolutely wear masks. Now the question of will they protect me or are they protecting everybody around me, that really has to do with the kind of mask that you're wearing. And I would say that any mask will afford you some level of protection. If you are wearing an N95 or a K95 mask, then you have a very high level of protection. If you're wearing a surgical mask, that level of protection is lower, a cloth mask lower, a bandana the lowest yet. But the real idea is if we can get the population to wear masks, that's going to protect the people around you. So the mask you're wearing is not protecting you as much as the mask the person standing next to you is wearing. And that's why it is so critical that we have widespread compliance. And I would say that since the governor's order and the parish president's order, that I have noticed a marked increase in compliance in wearing masks, and that translates to safety for our community.
Good answer. Thank you, Chuck. Next question is, what is the per capita infection and death rates in Slidell? Why is the information not easily available to the public? Well, you know, we get limited information from the state. The numbers from the state coming down are purely for state numbers. They're not for parish, they're not for municipalities. Our first responders have been fortunate in that they get a listing of positive cases that goes down to the addresses of individuals, so that if an ambulance or a fire truck or a police officer goes to a scene or is called out to a call, they know before they get there if this is a COVID positive residence or business or car or house or an individual. So they know specifically what they're walking into and how to protect themselves as they get there. What we've been able to do is get those numbers. The fire chief has helped us by giving us numbers that show the number of cases in the zip codes that are in the Slidell community, 70458, 59, 60, 61. So what we can't tell who the individuals are or what their specific addresses are because we don't have that information. But we do know the numbers in our zip codes. And right now, we are running about 40%, give or minus a couple of percentage points, of the total cases in St. Tammany Parish. In the first wave of COVID, the first spike, we were running right at 50%, 49, 50, 51 in that first wave. In the second wave, we're about 10 points lower. We're about 40%, plus or minus a couple of points, of the total cases that are in the parish. Now that's the only breakdown we have in Slidell government, and that's the number that I can give you. I can't share with you a street or a location in the community in particular, but I can share with you the numbers in the zip codes and where we fall out as far as the percentage of total cases in the parish. I guess you could take those numbers in those zip codes and the numbers of citizens in those zip codes and come up with a per capita number for the Slidell zip codes. But this is all raw data, specific numbers that are happening in our zip codes in our community. Dr. Preston, you got anything to add to that?
Well, no, just to reinforce exactly what you said, that we are looking at numbers of cases and deaths per municipality. Slidell, of course, being one of the most populated areas, has one of the highest case rates and death rates. It is running right around 40%, which is somewhat of an improvement. The other thing that I think that we have to be aware of is we are seeing a shift from the majority of cases being in congregate living situations, such as nursing homes and assisted living situations, to where it's now about 50-50 in congregate living and in the community. So again, it just reinforces that, if you remember, all of this started with one single case in Wuhan, China, and that's how pandemics spread. And so as long as there are people walking around in the community with the virus, we have the risk of seeing widespread infection.
Thank you, Dr. Preston. And just again, to reiterate, the 40% is 40% of the total cases that are occurring in St. Tammany Parish. About 40% of those cases that are occurring in our Slidell zip codes. Do you recall what the raw numbers were, Chuck, in our zip codes?
I really don't.
Yeah, we can get those numbers for you. If you want that number, if you call the office, the fire department, Fire District 1, puts out some charts that has those raw numbers in it, and we can share those with you.
And I would just add, there's no surprise that behind Slidell, the next most percent infections are in Covington, followed by Mandeville. So the areas that are the most populated with the most number of people have the most number of infections, which is just logical.
Highest incidence of infection.
Exactly.
Yes, sir. Dr. Preston, many people complain about not being able to breathe when they wear a mask. That breathing in your own CO2 is dangerous and that masks collect germs and make people sicker. Do you really think it's safe for everyone to wear a mask?
So first I'm going to answer the last part of that question, which is absolutely. I think that probably some people who have very, 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 very advanced emphysema and are oxygen dependent may be uncomfortable wearing a mask, but that's the population that really should not be going into public. That's the population that needs to stay at home because again, if they get an infection, it's going to be lethal. There was a very interesting study done several years ago that was aimed at the treatment of hyperventilation. And the treatment of hyperventilation used to be to have the person breathe into a paper bag. And the paper bag is relatively non-porous. And the theory always was that you would rebreathe your CO2 and it would raise your CO2 levels and stop that drive to hyperventilate. This study showed that there was really no significant increase in CO2. And so you're really not building up your CO2 when you're breathing through a porous mask. Yes, it can make you anxious. Yes, it can be very hot and uncomfortable, and particularly with a beard. I know that a beard in July and a mask, there's going to be a little bit of perspiration underneath that mask. In terms of collecting germs, yes, probably you are collecting germs, but you're collecting your own germs. And so those are not going to be dangerous to you. So once again, I really think the best advice possible is those 4 simple steps of washing your hands, cover your cough, social distancing, and yes, wearing a mask. It really is safe and it helps to protect the community. And again, if we can keep the number of cases in control in the community, then we can keep businesses open and the economy can continue to move forward.
Thank you, Chuck. According to the Louisiana State Attorney General Jeff Landry, the governor's mask mandate is unconstitutional and unenforceable. Mayor, why is the city following an unconstitutional mandate? Who is enforcing it in Slidell? Well, in reading the Attorney General's opinion, he says that the mask mandate from the governor's office may be unconstitutional. If it is, therefore, it would be rendered unenforceable. The bottom line is Slidell's not a nanny state. We're not walking around and writing tickets or enforcing people to wear masks. We're highly recommending that people wear masks where appropriate. We're asking people to wear a mask where appropriate. But we're not walking around pointing people out and saying you have to put a mask on or writing a ticket. Some businesses may restrict you from entering their business if you don't have a mask. That's their prerogative. We're not making that mandate. We're not enforcing that. The governor said that you should wear a mask. The parish president has said that you should wear a mask. We're asking you to wear a mask, but it's not a mandate from any of those agencies, nor is it from the city of Slidell. There was a rumor the other day that the Slidell Police Department was at one of the local Dollar General stores writing $500 tickets for people not wearing masks. There is absolutely nothing to that. That's so far from the truth, it's not even, I don't even understand how people could even say that. The sheriff nor the Slidell Police Department are not walking around, riding around, pointing people out, writing tickets for wearing masks. It's not going to happen. We're not a nanny state in the city. We highly encourage you to be socially and self-responsible. Take care of yourself and take care of those around you by wearing a mask, and hopefully we can slow the pace by covering our face and slow the spread of this COVID, our unseen enemy, and take advantage of reducing the curve, coming back down to a more acceptable level of COVID in our neighborhood, and maybe starting to approach a more normal life that we have come to know and love in our community. But there's nobody in the city that's enforcing the mask mandate, and the Attorney General said it may be unconstitutional, but bottom line is we highly encourage you to do so. Wear the mask and protect yourself and those that are around you. Dr. Preston, do you have anything to add to that?
Yeah, and I think that you really hit it right on the head. The issue is not whether it's constitutional or not. The issue is it socially responsible or not? Is it going to slow the pace by covering your face? And the answer to that is absolutely yes. There's no doubt about it. The risk of wearing a mask is very, very low, and the benefit is very, very high. And so to be considerate of your neighbors, to be considerate of the community, and to try and protect economic development, I think it is very important that folks wear their masks. And you know, there will always be naysayers as to why they shouldn't wear a seatbelt on the highway when they're driving intoxicated. That's a big high risk, and of course it puts other people at risk. And so this is kind of the same thing that, you know, we're encouraging everybody to wear their mask, and I'm very encouraged, like I said, that I'm seeing much more compliance in the community, and I think that's going to translate to a healthier community.
Dr. Preston, another question for you. It says here, I keep hearing that the only reason the number of COVID-19 cases are rising is because we are doing more testing. Is that true? Why should I get tested if I'm not sick and not showing any symptoms?
And so I'll have to give partial credit for that answer, that yes, the number is going up because we're testing more, but we're also following the percent positive. And the percent positive is going to be independent of the number of tests, and that percent positive is continuing to grow as well. I am very encouraged that in St. Tammany Parish, we are under the 10% mark for percent positive, but we're creeping in the direction of going higher and higher and higher. And so that is a concern. In terms of being tested when you're asymptomatic, there was a study released by Oxford recently that showed that 40% of the people who were asymptomatic were infected and were spreading that virus. I suppose the issue becomes, if you are willing to quarantine for 14 days, then a test is not so critical. If you're in a position where you're unable to quarantine, then that information might be useful to make a decision as to whether or not you go into public or specifically to return to work. So testing that gives you some guidance, I think, is very valuable. Additionally, it's valuable to have an idea of what the incidence of disease in our population is. But again, I think the most important indication for testing is for those people who are symptomatic that are going to need to make some treatment decisions.
Okay. So, questions for the mayor. Why should bars and other small businesses be forced to close or have restrictions, but big stores like Walmart and Home Depot can remain open without limitations? To my knowledge, the only business that's got any closure requirements on it are bars. Other small businesses, other facilities that sell alcohol and food are still open. All of these businesses are open with a restriction on their capacity, that being the big businesses, the big boxes, as well as the small businesses. I'm not aware of anybody in the city that has been called out for exceeding capacity in any small business nor in any big business. So I think that small businesses that want to be open, by all means, can be open right now, with the exception of bars. And the governor's last mandate said that bars have to close. They can do curbside takeout drinks or beers if your license allows such. But even with that, I'm not aware of anybody in Slidell that's going around and enforcing and saying, hey, you got too many people in your store. I think what's more important is that when you go into a store, do you feel uncomfortable with the number of people that are in that store? Or if you go into a restaurant, do you feel uncomfortable with the number of people that are in that restaurant? If you do, then you got the prerogative of removing yourself from that situation, which I encourage. If you're not comfortable, do remove yourself. But most of our businesses in town that I'm aware of are pretty much open and running at a capacity that may not be the ultimate for them, but they're running at a capacity where, with some utilization of outdoor seating and things of that nature, been able to recover or cover most of their businesses. The bar restriction, that strictly stems from what I was told from the governor's office around some of the bars at some of these college locations, that there have been increases of cases come out of these bars because there's a lot of people having fun, having a drink, letting their guard down, getting close to each other, and a lot of close contact, and they're trying to restrict that. So that's what's driving the bar business. As far as anybody in the city of Slidell enforcing that, we don't have the wherewithal to do that. We don't have the mandate to do that. The problem with the bars is that their license is issued by the state, by the Alcohol and Tobacco, ATC. And ATC can come in and regulate them when the city can't. So that's their issue. That's where they have to deal with the state, and it's not a local issue, it's a state issue. But the rationale is for bars that are primarily around college communities, is what I was told. So, Chuck, is anything you'd like to add, or?
Well, I am probably just restating what you said, but I think that really was a data-driven decision, that by doing contact tracing, we saw a very high percentage of transmission in bars. And of course, you know, if you think about it, really the whole idea of bars is to be very close and be very social, and it is, you know, it's just the nature of the beast that folks who get in there are going to have their mask down so that they can drink their cocktails and be very close to each other. And so if one person is infected and they go into a bar that has 50 people and they spend an hour or two there, they probably infected at least half of those people who are going to go out and infect more people, and so it's this exponential growth. So I don't think it was intended to be punitive to the bar industry. I think it was really based on data that because of the behavior of folks who are in bars, that's very close unprotected contact, and the transmission of the cases go up very quickly.
Last question, and it says, I'm surprised that the school board has said that schools will reopen with minimum safety standards in place. No more than 25 students in a classroom, and masks are only optional. Mayor Cromer and Dr. Preston, would you be comfortable sending your children to public school in August? You know, we talked a little bit about this before we started. I don't really know what all the guidance and direction that's coming from the school board yet. I know they were supposed to have a meeting this morning on that very issue. So I'm not really sure. I know they're talking about maybe a hybrid approach where you'd have half the classroom today and half the classroom the next day. And then there was one class, full occupancy, 20 students, that you bring your lunch in when you came in and you went into the classroom, and that's where you resided the whole day. You didn't go out into the playground, you went to the restroom, you didn't go to the cafeteria for breakfast or lunch. Everything occurred in that classroom with that cadre of children and teacher's aide. So they were limiting exposure to only the folks in that classroom. And then there's the option of possibly online classes, and you could sign up for that. You know, I don't know exactly where that's going to fall out. I know they're talking about bringing kids in, I think the 11th of August through the 14th of August, about 25% per day for that week, and how it would start the next week, I don't know. If it'd be the full class, some in hybrid classrooms, some at online classes. There's a number of options. Would I feel comfortable sending my kids out? I don't have any kids, but I've got a grandson. And if the precautions are put in place so that you have enough distance between the students in the classrooms and the teachers and the aides, I'd be comfortable sending my grandson to school. Every day that he misses in school, he's falling further behind. Last year they missed 3 months, March, April, and May of school time, and his reading abilities are falling behind. His math capabilities are falling behind because he's not getting that emphasis and practice at home that he would in the classroom. So to answer the question directly and say right now would I be comfortable, I can't answer that until I have more information. And that information I hope is forthcoming from the school board and the school system. And that's exactly how they would handle kids in class, how they're going to space them, mask protocols, all of the things that affect those children being in the classroom, getting to school, whether it be bus, cars, whatever, getting from those lines, getting into the classroom and maintaining their day. Chuck, help me on this one. Can you give me some?
Well, I think that's a very astute answer, and it really goes back to trying to make the best decision based on the facts available at that time. I know that the school board is very aware of the risks involved. I don't think there's a one-size-fits-all answer. You know, the protection that a kindergartner or first grader may be able to avail themselves is vastly different than what a high school student may be able to avail themselves. And, you know, again, it does seem like it's right around the corner, but we have to watch the incidence of disease in our community and see if it's ramping up or ramping down. But I think the real issue is parents will have to take a pulse at the time. And like every other decision, it's a risk versus a benefit. And just as the mayor alluded to, there is some obvious benefit to keeping kids in school and staying on track with their education. But there's going to be some risk involved. And so as much as parents can educate their children about how to mitigate those risks as much as possible, and I've seen some very young kids out wearing masks, and I really applaud that the parents have been able to encourage them to do that, then that will help to mitigate the risk. I think that this is going to be a case where we're going, well, the school board has already said they're going to stagger the beginning of school, and so they're already making some adjustments to take into account the dangers of the pandemic. But I suspect that we're going to start and we're going to remeasure and reassess, and then take new measures and reassess. So it's going to be an ongoing process. I have a lot of confidence in all of the members of the school board and the interim superintendent that they have the interests of their children as a top priority, and they want them both. They want them safe, and they want them to get the adequate education that they need.
Yeah, I think they have the best interest of our children, of our community, in all of their decisions and what they're doing. This is a tough decision, and it's like the mask question. You know, should we wear a mask? Should we not wear a mask? Who makes one call, changes the call, CDC, back and forth. As we get further into this, and as school gets started, we're going to find that we're probably going to make some mistakes, and we're going to make some good calls. The school board's going to do the same thing. The ability to recover from those decisions that may not be the most optimal and reduce risk from there are what will make us successful in the school year as we go through this and learn more about how to handle this and handle our children being in the classroom. The experts will engage in, as Chuck said, there'll be reevaluations constantly ongoing to determine the best manner to put kids in school and to educate our children. And I, for one, hope that my grandson is able to be in a classroom this year and engaging in the learning process. I never thought that I would hear this from a third grader, but he's actually told me he misses school, which that surprises me about him. I think he meant more that he misses his friends, which is probably not the best attitude to go into school and to try to social distance. But the social interaction is a big part of the education process, and getting kids in classrooms and having them integrated with their peers is a big part of the education process. So we need to do that in as safe a manner as possible, but we definitely need to do it.
And I would just add, I think of all the questions that we talked about, that this one really struck me emotionally the most, because it really drives home the notion that this pandemic is affecting individual people and families in a most tragic way. Families who have done absolutely nothing wrong are finding themselves in lines at food banks, are finding themselves without health care insurance, and now they're finding themselves having to make very difficult decisions about the future of their children and their education. So, you know, I would love to be able to wish the pandemic away, but that's just not going to happen. It's going to take a lot of individual effort by socially responsible people to try and slow the pace of the spread.
Well, Dr. Preston, that's all the questions we have, and we're coming up on about 45 minutes, or 40 minutes or so. Is there any closing statements or remarks you'd like to make before we wrap this up?
Well, again, I would like to just encourage people to pay attention, to recognize that this is a very dynamic situation, and it literally changes day to day. Government is not going to solve this problem. It is the behaviors of individual citizens that will either move us forward or move us backwards. And I encourage everybody to not get bogged down in the politics of coronavirus, but to see the big picture and to recognize that we really are in this together, and we have to face this as a community and to take individual responsibility to keep our schools open, to keep our businesses open, and just like the mayor said, you know, any chance you get to shop locally, these businesses are suffering and they need our support. So spend your dollars in St. Tammany Parish.
Thank you, Dr. Preston. And with that, I'll just conclude by saying what we started with. Go and shop our local shops, our local mom and pop businesses. I don't know of anything that you would shop for in your daily life that you can't get from a locally owned business here in our community. Take advantage of that. Get to know those folks. Make friends with them. They're the ones that support our community and support our economy and give us opportunities to get what we need right here in the community. So take advantage of that situation and go shop those folks. Go shop with those folks. Spend your money there. Keep your money in the community. Helping local businesses sustain themselves and their families. Again, we are not an anti-state here in Slidell. We're not going to be an anti-state in Slidell. Dr. Preston said it best, government's not going to fix this. It's the individuals that will fix this. We recommend that you wear a mask. By all means, I encourage it. I wear a mask at all times when I'm in the public and interacting with people. I encourage you to do the same. I'm doing it for those that are around me as well as for myself. But if you come and talk to me and you don't have a mask, I'm not going to tell you to put your mask on. I'm not going to tell you that we're going to call the police on you. We're not going to be an anti-state here. It's going to be your choice to make an informed decision, and hopefully we're giving you enough information to make an informed decision and to encourage you to wear your mask. Cough in your elbow, stay socially distanced, avoid crowds if at all possible, shop local. That's it from City Hall. This is your Mayor, Greg Cromer, and our Parish Corner, Dr. Chuck Preston. Thank you so much for joining me today, Chuck.
My pleasure.
Greatly appreciate your input. It's always very enlightening to get the medical profession's perspective on what's actually going on with COVID in our community. So, have a good afternoon, Slidell. Thanks for joining us today.